The first thing that we have to know is that unfortunately, even in the best scenario, we do not have 100% success rate. So most of the time, when we have a single egg donation that has not worked, our recommendation is going to be to move forward and try again. However, there are cases in which we may already think that there is something wrong, and in this scenario we can, or we would have like two branches, the first one is studying if there is anything wrong on the male side, and this is important regardless of the quality of the spermiogram. Sometimes a patient with a normal sperm may have a high percentage of sperm carrying genetic issues, and this is going to have a big impact on the genetic quality of the embryos and may explain a lot of recurrent negatives or miscarriages. There is a test called FISH that basically assess if this percentage of sperm with genetic issues is normal or not. Obviously, the other branch is going to be if there is anything wrong in the endometrium, in the uterus, or in the body of the patient. We can assess if there are clotting problems, checking or studying the thrombophilias. We can see if there is any kind of autoimmune disorder, especially antiphospholipid syndrome. These are tests that are going to be studied by a blood test. We can study if there is local processes in the endometrium that can interfere with the implantation, like checking for chronic endometritis, doing endometrium cultures, recommending hysteroscopies to get a direct view of the cavity and confirm that everything is okay, shape, endometrium quality. And there are other studies that are really recent and still controversial that basically let us know if the window of implantation, that means that we are transferring the embryos when the endometrium is fully receptive. This is a test called ERA, and it's still controversial if it really is really useful, because this window of implantation depends on when the patient starts the progesterone. So in some cases, it could be useful to start the progesterone before or later to make sure that whenever we transfer the embryo, this endometrium is fully receptive. But in any case, implantation issues are probably the most complicated to study because the majority of the information or most of the tests that we have are tests that give us information about an embryo that when there is no embryo there. So assuming that what happens when there is an embryo or when there is not can sometimes be slightly tricky. So basically, first step would be considering if it's worth repeating without doing any other test. And then if we think that could be something else wrong, then check the male side, regardless of the quality of the sperm, and carry out some tests on the uterus, endometrium, and in the body of the recipient to see if there is anything that can be interfering with the implantation of those, in general, really good embryos.